Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown. Hi, I'm Aanchal Bhatia, author of Your Doctor is Not God and How to Be the CEO of Your Health. I believe that health is by choice, not by chance. I am a clinical psychologist by education and an entrepreneur by profession, and a social change agent by passion. I'm a wife and a mother of 2 boys. My husband and I are one formidable team, and that's how we founded Sydenham Clinic, a private health management clinic here in Houston. Welcome and let's explore. Hello and welcome back to Life Sutras. I'm your host, Aanchal Bhatia. It is October, which is Breast Cancer Awareness Month. And who better to have with us than Dr. Mahesh Shetty, one of the most notable radiologists in Houston, Texas, who has been at the front of this field for almost 25 years. Welcome, Dr. Shetty. If I may introduce Dr. Shetty is actually the author of 2 gynecological cancer books. One of them is on breast and the other is on gynecological cancers, amongst a dozen other journal articles. So he truly is an expert. He is also the clinical professor of radiology at Baylor College of Medicine and is the owner of women's clinic called Pink Door here in Houston. That's where all our clients at Sydenham Clinic go, because if I'm getting a mammogram, I only want Dr. Shetty to read it. So without further ado, and with much excitement, Dr. Shetty, welcome. Welcome to Sydenham Clinic.
Thank you, Aanchal.
We've been trying to get you to come to Sydenham Clinic, but you've been so busy, but thank you for finally making it.
Not at all. It's a pleasure to be here, and thank you for having me.
So, Dr. Shetty, my first question to you. We all know that breast cancer is the most common cancer, and it is the second leading cause of death amongst other cancers that cause. But it can be detected early, right?
Right.
And early detection is key for breast as well as other gynecological cancers and women's cancers. Can you tell our listeners a little bit about early detection and a little brief about what these cancers are, what to look out for?
Okay, so with breast cancer, the reason early detection is so important is because breast cancer goes through a phase. The initial phase is where the cancer is in the ducts, inside the ducts, and the whole point is to find the cancer when it's inside the ducts. And mammography is the best tool we have right now in detecting cancer at that stage, and that is the stage 0 cancer. The outcome from breast cancer is totally dependent on the stage of diagnosis. The earlier you detect it, the better the outcome. So much so that stage 0 cancer has almost 100% survival rate. So that's important, and mammography is the only tool. And talking about the phases of growth of breast cancer, eventually it'll come out of the ducts, eventually it'll become a tumor in the breast, and then it'll reach a size when either the physician examining a woman or the woman herself will start feeling a lump. Our idea is to find it before that happens.
And it could be up to 3 years before you. I was reading somewhere that it could be 3 years later that you start feeling something.
Yes, and the idea is to find it before. Now, having said that, we still want women to be examining their breast on a regular basis, at least once a month. And the best time to examine your breast is a week after your cycle, because during the cycles and immediately before, the breast can feel very lumpy. So it's better to examine your own breast a week after your cycle on a monthly basis, and also have it examined by a physician once a year. So that's an added layer of security in addition to mammography, which is the best tool to find cancer early. So the key take-home point here is early detection is the only way we can fight breast cancer. And mammography is the only modality available to find cancer at that stage. Now, your question about other gynecological cancers, there are two main cancers. One is ovarian and one is endometrial cancer. Endometrial cancer generally affects women in their 50s and 60s, postmenopausal women. And fortunately, they are diagnosed early because the symptom of endometrial cancer is abnormal bleeding in a postmenopausal women. And such women usually get an ultrasound with us, and we examine the inner lining of the uterus. And if the lining is thick or abnormal, then they get a biopsy and endometrial cancer is diagnosed. The incidence of endometrial cancer has been going up because it's directly related to being overweight or obese, increases the risk. And that's endometrial cancer. Unfortunately, the other main killer cancer is ovarian cancer, which seldom gets detected at an early stage. Most of the ovarian cancers are detected at an advanced stage. So
And these are aggressive cancers mostly,
no, they grow silently. And if women are not going to a doctor or having an ultrasound, it's often diagnosed when it's 7, 8, 10 centimeters by the time it's too late.
Right.
So the mortality rate from ovarian cancer is very high, significantly higher. So what can you do to prevent it? There are some symptoms that you need to be on the lookout for. Mainly amongst is weight gain, feeling tired easily, discomfort in the pelvis, things like that, urinary symptoms. It's important when you have any of these symptoms, at least to go to a gynecologist and get yourself checked. Now, ultrasound will find cancers at any stage, but the problem is women don't get ultrasound on a regular basis unless they have a problem.
But why not?
Why not use ultrasound for screening? So they have done lots of trials. And what they have discovered is if women there is a blood test which it's not the best test out there, but still, it's called a CA125. It's just like men have prostate detecting tests. Women, there is CA125. The CA125 levels are high, then there is a risk for increased ovarian cancer. So if you take those women who have increased CA125 and perform ultrasound on all those women, then it has been shown to be beneficial, but it's not widely used yet, like mammography.
Right.
But yes, ultrasound is a very quick and easy way of looking at the ovaries and detecting cancers when they're small.
So, since it is Breast Cancer Awareness Month, I want to focus our conversation a little bit on breast cancer. Can you explain to us what is a mammogram? What is the difference between a good mammogram and a not so good mammogram? What is the difference between a good read and a not so good read? How can things go wrong, and what to expect from a mammogram?
Okay, so mammography is essentially a very high resolution X-ray of the breast. And of course, now in the past 8-9 years, we have 3D mammogram where thin slices of breast tissue are examined. So that's the technique. So essentially like an X-ray, which is done by compressing the breast and taking the image. And your question as to what's a good place and what's a bad place based on technology, fortunately, back in the 90s, the government got involved and they were aware that we have to standardize mammography across the board. So a law was passed by Congress. It's called as Mammography Quality Standards Act in 92, which very strictly regulates quality. So every breast center will be inspected by a federal inspector once a year. We have very stringent requirements for quality assurance and quality control of images, keeping the equipment state of the art. So technology-wise, for the most part, you will be fine.
United States.
In the United States.
Right.
Now, because it's very highly regulated. Now, the other question you talk about, what about the readers? We are required to maintain and do an audit, and there are some metrics that we have to reach. And one of the most important is the recall rate. Every 100 women who get a mammogram, about 12 to 15 women will be called back for extra views. So that's called as a false positive rate. For instance, when I do my audit the past several years, my recall rate is half of the national average, 6 to 7%, which is good. That means I'm
Fantastic.
calling fewer women. And
Right.
it's anxiety, waste of time, all of that. That is one metric. The second metric is if I were to recommend a biopsy for an abnormality in the breast, what is the positive rate of cancer? This national average is supposed to be 25 to 35%. In other words, 3 out of 4 biopsies are normal. So it is a false positive. So we want to keep the false positive low because we don't want to subject women to unnecessary biopsies. Again, anxiety, morbidity, and all that stuff. So that's another metric. My positive rate is about 40 to 45%, much higher than that.
Fabulous.
So those are the metrics you look for. Now, can you get this kind of information from breast specialists? Usually not, but the information is there, but it is held within the center. But what I do is anyone who works with me, I look at their metrics and I tell them to take corrective action if they fall outside of the range of uh, the nationally recognized benchmarks.
Right.
So that's the answer to your question of which is good, which is bad center. I think it's important to go to a center which has experienced breast radiologists who've been doing this for a long time. It's important to go to a center where radiologists who are specialized in breast are reading. So those are the two things to be careful about.
So sometimes when you do a mammogram, it comes out that you have a dense breast. And what does it mean for women? What are the different kind of findings that you get from a mammogram?
Okay, so that's an interesting question. The dense breast is very important because it has two implications. For instance, a woman with a dense breast has a higher risk for breast cancer. So there are 4 degrees of density. One is a breast that is entirely fatty replaced. Those women have the least, their risk is the least. A woman with an extremely dense has a higher risk, almost 2 to 3 times higher than a woman with a fatty breast. So it's almost like having a sister with breast cancer, like strong family history. And the other problem with dense breast is mammography becomes less accurate. Things can be hidden or by the dense tissue. 3D mammogram will help because it slices through the dense tissue. Even so, the accuracy of mammogram is lower and your risk for breast cancer is higher. So women with dense breasts have to be very careful about getting their mammogram every year and also talking to their doctors if they need to get an ultrasound on top of the mammogram to increase the accuracy of cancer detection. So that's where dense. And most of the states have enacted a law which requires the doctors to inform the patient of the breast density, including Texas.
Right. When you're getting a mammogram, what are some of the things that an ordinary woman should know? Or in fact, men also get breast cancer. And so I would want you to address that question as well. But what are some of the challenges that can happen? Can you get burned? Can you get injured during a mammogram? Like, what exactly happens when you go in for a mammogram and what can go wrong?
Generally speaking, nothing goes wrong, but there are some misconceptions amongst women, especially women with an implant. Some women have a misconception that it can damage the implant. The answer is no. Some women think that if they have an implant, that the cancer may not be detected. That's also not true because we employ techniques in women with implant where we push the implant and then take the mammogram. So the accuracy is the same. So the direct answer to your question is really there is nothing to fear about mammogram. Obviously, the worst part of a mammogram is the discomfort because you have to compress the breast. Women have to stay still for the duration of the mammogram, which is very short. And some women, especially if they have very tender breasts, especially around their cycles, it can be a very uncomfortable experience. So it's kind of good for women to go in for a mammogram when their breasts are not tender, especially if they tend to get cyclical pain during the cycles. It's best to avoid getting a mammogram when your breasts are very tender.
Right. And my last question, and we move on from mammograms, is how often, I mean, there was some controversy around this as well. What is the guideline today, and how often should you have it done, and what is the criteria?
I know, yeah. Well, part of the problem is there is so many conflicting guidances coming from national societies and the United States Preventative Task Force. I would totally emphasize, if there is one thing I would like to emphasize in our conversation, is extremely important to get a mammogram every year starting at the age 40, and keep getting the mammogram until you are in good health, which may be 85, 90, because I saw a 93-year-old with a large cancer. It can happen. She didn't come for a mammogram.
93-year-old?
Yes, and she was otherwise fit, very fit. She drove herself in, but she was not getting mammogram after her 80s, and then now she comes with a 5 centimeter cancer, and her health was so good. We have women in their 80s who are in perfectly good health, so it's important, and you do not want to go through breast cancer and chemo and all of that
No.
in the final phase of your life. So it's important to find it early. And women in their 80s, when cancers are found when they're small, treatment is simple.
Yes.
They do a lumpectomy. In
Right.
most instances, they don't even do radiation and chemo.
Right.
Because of their age. So a mammogram should be continued until for as long as you're in good health. Every year is important. Now, if you have a strong family history of breast cancer, extremely important to start 10 years before the diagnosis of cancer in a first degree relative. If you have a sister who was diagnosed at 38, then you have to start at 28. And then you have to use methods other than mammogram and ultrasound, such as breast MRI, which is the most accurate way to find cancers. But it's not done on all women because of the cost.
Right.
And it's not available to an extent that all women can get a mammogram.
Right. Well, that is very, very useful information. There was a lot of confusion around this every year or not every year, but you are absolutely clear on that. Please get your mammogram every single year after the age of 40. What about men?
Well, so men, breast cancer is very rare,
Yes.
as you know.
In the last 1 month, I have heard of 2 cases.
Yeah, it's been going up. In 1991, there were about 900 men getting breast cancer in the United States, and now it's gone up to about 2,800. So it has tripled in 30 years. And also the problem in men is because they don't seek attention, the cancers are diagnosed later, so the mortality is significantly higher. So it's very important for men, if they feel a lump in their breast, to immediately go get a mammogram and an ultrasound and a biopsy if we find a tumor. But it's there. And by the way, breast cancer kills more men than testicular cancer. So
Is that right?
Yeah, it is still something that kills more men from cancer, as I
Right.
said.
Because I guess it gets detected so late in
Yeah,
men because
yeah.
they are not doing mammograms.
And they don't expect it.
Right.
About 500 men die from breast cancer each year in the United States. Of course, compared to women, 40,000 women die each year from breast cancer. And that the death rate from breast cancer has remained steady, but the incidence of breast cancer has gone up tremendously. It's now 250,000 women each year in the United States, which is like 1 in 8 women will get breast cancer in their lifetime.
And why do you think that it is? Why is it going up?
There have been several lifestyle things that come into play. Number of children are fewer now, age that you have your first child, and nutritional habits, meat, alcohol, all of these lead to obesity. Obesity is a risk factor both for breast cancer as well as endometrial cancer. So lifestyle changes, hormonal changes.
Yes.
And that's why, even in countries like India, where breast cancer was lower before, but if you go to big cities like Mumbai and New Delhi, it's much higher because lifestyle change, fewer children, eating habits, all of those things have contributed to an increase in incidence.
I guess as much. That is why at Sydenham Clinic, our whole focus is lifestyle medicine. It is not just early detection and diagnosing and treating. We take 5 steps back and help you modify your lifestyle, because I just feel that 70 to percent or 90% of diseases are caused because of lifestyle factors. So the cure lies here. It has to
Absolutely.
start earlier.
Absolutely.
Um, I want to know more about Pink Door. Tell us, more about it and your journey. How come you took this entrepreneurial step, and you decided to start these fabulous clinics here?
Yeah, the reason is, I started off at Bentob. I was the director of the breast center at Bentob in the late 90s. And then I went to Women's Hospital and ran the breast center at the Women's Hospital. And then having seen a like a community kind of hospital and
Yeah.
then a private hospital, I kind of realized it was important for women to get more personalized service. So I wanted to open something really small, boutique, where how does it distinguish from other breast centers? Number one, it is fewer patients, they get personalized care. It's easy access. When we say access, it's not only in being able to get appointments quickly, parking is simple, then you walk in, and then next comes the environment. I wanted a very warm and inviting environment. I did not want a cold clinical environment like what we see in most of the breast centers. So what we have achieved is a very warm and inviting atmosphere that women like. Plus the quality is there, and then most women get their results the same day. Women who come with a breast symptom and are investigated, I talk to them, explain to them what I see. Even if they don't need anything, then I talk to them about their risk factors and what I try to tailor screening based on their risk factors, whether it's use of mammography or ultrasound or MRI. And then we help them through the journey of breast cancer. I mean, they go through, we refer them to MD Anderson or any other breast surgeon. And once they're treated, they come back to us because we have to monitor for any recurrence or any new cancers. So it's a really good experience for them. Every patient that I see
So
gets
you were
my.
passionate about the whole user
Yeah,
experience.
absolutely.
And what drew you to women's health radiology? I mean, as the subspecialty. Well, tell us a little bit about your journey. Why did you become a physician,
Yeah.
and
Oh,
why are you here at this
I
point?
became a physician because, growing up in India, the concept is it's good to be a doctor. And my family was full of doctors. So I was a fairly good student. I had great grades in high school. So I took up medicine. And then I fell in love with it because it's very gratifying. What you do is gratifying. And the patients you serve, it's an amazing experience when you see the happiness when we provide the best quality of care. Now, women's health was kind of thrust on me. It was not, it was serendipity. My mentor at Baylor College of Medicine, Dr. Al Watson, called me into an office in the 90s. He said, "You are going to head the breast program at Bentob." And I was like, "Really?" What? So that's how it happened. But it's one of the best things that ever happened to me. And I've loved every minute of it. Women's health is good because I find women are very conscious about their health. They're self-advocates, and so it has been a very professionally enlightening and fulfilling journey for me.
And you do have two daughters, and you're a fabulous role model for both your
Oh, I
daughters.
hope so. Yes.
Which brings me to my last question. I often ask, in fact, every time I ask my guest, what is their secret sutra? Sutra in Sanskrit means rule. So these are our personal lifestyle rules. Since you are educated, you are more aware. And I know you do follow a very, very disciplined lifestyle. Can you share with our viewers what your secret sutra is?
Okay, my secret sutra is physical fitness and eating healthy and eating in small portions and traveling and nature and hiking, which is such a relief from the day to day stresses of life. Um, and also being calm and trying not to be affected by all of the conflicts that surround us in our daily life. So basically,
So you are mindful of these things on a daily basis.
yes, yes, very much so. And try not to stress. Try de stressing techniques, which can be as simple as just exercise or sitting quietly and meditating. So those kind of things, simple but effective.
Right.
Yeah,
Sometimes the answers are very simple, but
Yeah.
it's the consistency,
absolutely. And discipline.
yes, and the discipline of following through on a daily basis.
Yeah, of course.
Well, thank you. Thank you for, I think this is going to be life changing for some people because a lot of people did not have basic, simple knowledge. And it's profound that you say that we should have a mammogram every year. I'm sure half the people listening to this did not know the simple fact that we should have a mammogram every year. So I'm very happy that we are bringing this important nugget of wisdom to our clients amongst all the other interesting things that you shared with us today. Thank you, Dr. Shetty. Thank you for being here with us. And
Thank you.
until we have you back next time, have a nice day.
Thank you. And I must say, you have created an amazing clinic here. And I really, really wish you well. And I am positive, confident that this is going to grow. And I think this will be a huge asset for the Houston community. I think you have done a wonderful thing.
Thank you.
Congratulations and best wishes.
Yes. No, we are trying to change the way medicine is practiced. Healthcare needs to be looked at differently. It really needs to be wellness care, health care, not just sick care or disease care. And like your whole experience at Pink Door is so comfortable and private, that's what, we try to make it. But all our members are coming to you regularly for their mammograms, and thank you for taking care of them. Thank you for being on the show. So until next time, health is by choice, not by chance.